Well, there have been multiple high-profile prostate cancer announcements in the news lately, so doctors everywhere are weighing in on the common myths about the disease and the importance of early screenings.
Joining us today is Dr. Robert Princenthal. He's medical director for RadNet, San Fernando Valley's prostate imaging program. So happy to have you here.
Thank you very much.
Let's get right to this. What are the signs of prostate cancer?
Prostate is a silent killer. There aren't very many signs, and most men confuse the signs of having a big prostate or BPH as being associated with cancer, and it's not true. And the signs of prostate cancer only occur when the disease is late and advanced.
All right, so what age do you think one needs to start getting screens, and also are the screenings covered by insurance?
Well, the screening is a PSA blood test, and that is covered by insurance. And we recommend that men get screened at 50 unless you have risk factors. And that would be strong family history or men of African American descent. They should be screened starting at 45.
Why do you think that people are reluctant to do this if it's that simple?
Because in the past, the treatment for prostate cancer caused a lot of functional limitations. And a lot of men were more concerned about the post-surgical side effects rather than being cured of their cancer.
Well, what are the treatments?
Well, I like to put it into a little bit of context. Prostate cancer and breast cancer are the same for men and women. 230,000 men and women get the disease each year, 30,000 men and women die each year. But unlike breast cancer, if you have low-grade prostate cancer, we do nothing. It's called watchful waiting or active surveillance. If men have intermediate risk disease, they have treatments of either surgery, radiation, or targeted focal therapy, non-surgical management.
Yeah, and the point is you don't want to wait until it's too late.
Correct.
Right. Yeah.
If it's caught early, the survival rate is over 95%.
Let's talk about, Glenn mentioned it at the beginning here, Secretary of Defense Lloyd Adams, Sidney Poitier, Harry Belafonte, Colin Powell, the list goes on and on. African Americans getting a prostate cancer. Why is it so prevalent with the African American population?
And don't forget Dexter Scott King, who you did a nice feature on last week, dying at 62. There are several reasons. One is the racial disparity of access to health care. That unfortunately some black men tend not to go to the doctor, or they don't want to talk about prostate because it's kind of involved with their masculinity. And then there's a genetic mutation associated with African American men. So they have higher grade disease, higher risk disease, and they tend to present late. So that's why their death rate tends to be higher.
Okay, is there a difference in the PSA test for black men compared to what Caucasians?
No, the PSA is the PSA, and most people feel that a PSA over 2.5 deserves an investigation. And what's really revolutionary now is instead of having a urologist stick 12 needles in the prostate without guidance, we're advocating MR first. If you can see the tumor, you can hit it with a needle. But more importantly, not all men with an elevated PSA have cancer, so we can avoid a lot of men getting unnecessary benign biopsies.
So you're basically saying that unless you have family history, if you do have family history, go in earlier than 50. If not, start at 50. Ask your doctor specifically, I want to take this test.
Exactly, you bet.
Okay.
So that PSA, it's a number, right?
Yes.
So is there a difference between the races on that?
No, and unfortunately, PSA tests can fluctuate widely. Bike riders, inflammation or infection can cause a false elevated PSA, or also just having a big prostate gland can cause a false elevation of PSA. So it's important to get a baseline, see what your trending is, but act on it. But before you get a needle put in the gland, ask for an image first, get an MR and find out what's going on.
Interesting. All right. Well, thank you so much. Such important information. We really appreciate it. 62 is too young.
Yes.
Right.
Thank you very much.
Thank you.
All right, you can reach Dr. Princenthal at RadNet in the San Fernando Valley, the website and social media on your screen there. We'll post it on KTLA.com in just a few minutes as well.
All right.